20th of this month. Children 12 years old and up can get the jab. Let's discuss this with our Deputy Health Minister, Dr. Sibongiseni Dhlomo. Doc, thanks so much for joining us. So what led to the decision to open it up for 12-year-olds from next week?
I was saying thank you very much and good evening, Sally, for inviting us. This has always been in the pipeline. You probably are aware that we did lose some of our youngsters in this age group. So COVID has not been very kind also to young people. We then started consulting scientists whether this could actually happen, and therefore they were advising us. We then said, if it is possible, then can the regulatory authority SAPRA register this vaccine for this age group? And yes, it was successfully done 2-3 weeks ago, and therefore we decided that maybe let us say to the youngsters, go there ready for exams, should not have any inconvenience to get a jab before you do or as you start your exams. So it is something that is also done and considered by other countries in the world. We also have taken that advice, and therefore the jabs will start on Wednesday, the 20th, for all 12 to 17-year-olds in the country.
All right. So talk to me about this issue of children not needing to get their parents' consent. Apparently it's part of the Children's Act. Just explain what that means exactly.
It's, as they are saying, Sally, it's part of the Children's Act that children may not necessarily have to get the permission of a parent to access this type of a health service. Even if, this has been a debate in the past, and we were glad that the sort of the act has gone this way. Can you imagine a 16-year-old who actually, not because we want as parents to start to be sexually active, and therefore we need to get that, and the child decides, look, let me go to the clinic and get my family planning devices without really discussing and sharing with my mother. It's a very responsible stand for that 16-year-old, and therefore that is why we were actually in health supporting this situation.
I hear you.
However, if it is actually a family where they can still discuss, it's well and good, but we are actually saying every 12-year-old up to 17, they could actually come to our vaccination sites and get a jab, and it's a one dose for them, as we have been advised by our
I understand.
sort of, advice.
So I hear the parallels you're drawing with a responsible 16-year-old who's going to family planning and perhaps getting the pill. And yes, of course, there are risks that can come with the pill. But at the same time, you can hardly give a child in school a panada these days without parents' consent. Do you expect this issue to become a problem? Because we know that there is a group of people in South Africa who do not believe the science, who do not believe that the vaccine is safe, even though we know it is. Are you anticipating that this could become a problem?
Sally, we have now saying as a government, as a department, we have a vaccine now available for the 12 to 17-year-olds. No coercion, no mandate, nobody is forced. Parents can discuss this with their children, but also children who probably would want to come and have it done, they can have it done without really having to seek a parental consent, just like we are saying the Children's Act allowed that. So we are not really saying we would be disappointed if there are children here and they do not take up this offer, but overwhelmingly we have already been getting a lot of calls from various parents who say, but like we are losing children in and around schools, around COVID, when are you going to do this for children? So that opportunity is available for those parents now.
I understand. What about a situation where there's a medical record or a lack of a medical record, and a 13-year-old arrives at the clinic and says, I'm perfectly healthy, I want to get the jab, but what they haven't disclosed, perhaps, is a condition which might give the nurses pause before giving that vaccination. You don't have access to that child's medical records. You don't have a parent giving a consenting response. And also, that child might then go home and not tell their parent they've had the vaccine. And if there's an adverse reaction, surely then the government is liable.
Sally, I would imagine the same story can be said about me and you, who probably do not disclose any medical condition, but if these children do know their medical condition, but the same story can be said again.
You see, the difference is they are minors. They are under the age of consent in terms of they are under the age of maturity, rather, and that's the concern I have, and I just want to engage on that. How do you get around a concern that a child might have a medical condition that they're not talking about, or maybe not even really aware of?
Yeah. Look, I would want to say, Salim, as we are opening up this opportunity, we don't want to clandestinely vaccinate children. It must be something that even them, they can talk about it. And hence, we are saying, if parents, in fact, we would still expect that most parents would take the offer and come with their children or actually give them a notice, because there's nothing that says a parent can, because there's a 16-year-old, cannot still give a consent. The parent might say, I agree, my daughter is going to come to your clinic and do this and that. So what I'm saying, for those who want to come in and access it, we are free to receive them. But for those who would like to accompany their children and make sure that they are there, that is another good option. We welcome that. It's just that there are parents there, there are families there who are waiting for this opportunity, and we are now saying the opportunity has been opened by government. Come Wednesday, the 20th.
Yeah, look, I mean, certainly my kids are going to be lining up. They can't wait to get back out again and perhaps socialise a little more than they have been. What about children in state care, children who are living in orphanages or children in foster care, and even street kids? What is the provision made for those children?
Sally, we have opened up for the 12 to 17-year-old. There will probably be a guardian in that foster care arrangement. There will always be a guardian in that institution of children who are probably mentally challenged. I think we'll have to go through that, because they too probably are taking overall the parental guidance and support for those children. That also will welcome. But we will not go willy-nilly and just vaccinate as we wish. As people come forward, this will be done very responsibly. We will not want to do and actually do it in such a way that it actually deters us from what it was intended to. The intention for this is to actually support our South Africans, our children who have already been there asking for this vaccination. So we are really making that opportunity open, and we are not going to do it clandestinely. But we needed to make an announcement that is available. If there are any challenges for that family, for that school, for that orphanage, we will tackle that as we go along.
So I think a lot of parents, and maybe some kids as well, might be keen to get the vaccination, but they're just a little bit hesitant, probably because of everything they've seen and heard, and there's so much noise. What would you say to a parent or a child who's concerned that maybe, say, in 5 or 10 years' time, suddenly a problem with the vaccine will be discovered that's not been picked up yet? Can you say with certainty that won't happen?
Sally, like I did make in my opening remarks, we will be giving a one jab to these children. We'll be giving Pfizer one jab. We will not take them to the second jab. Why? Very, very few cases have been recorded of a transient myocarditis. What is that? A little bit of a pain in the heart, which is transient, to say I just feel a bit weak and here my heart is pumping too fast for 3 or 4 seconds. Hence, that is something that we have been advised by scientists. It usually comes in those very few cases when they take the second jab. So the precaution, let us give all our South African children only one dose and leave it at that. So that is already another precaution. While they are further making studies and actually checking whether there is any other bigger challenges. Look, you know, there's nobody who has been very authoritative on the COVID-19 before 2018. We learn as we go along. However, we will not deprive people of the world to receive what actually scientifically has been recorded to be the good way to go, while the further research is being done on this matter. So we err on the side of caution, one vaccine for the children.
Yeah, it does sound like a cautious approach, and I think it's perhaps cautious to get the vaccine because we also don't know the long-term impacts of getting COVID and what it might do, long COVID might do to our overall health. Talk to me about the overall vaccination rate. Where are we at the moment in terms of percentage of adult population vaccinated and how many jabs we've given out?
We're very excited about the progress that we are making, Sally. We're trying our best, and thanks to our healthcare workers out there, to actually get about 200,000 vaccinations per day. And right now we are sitting just over 19 million doses that have been given to over 13 million South Africans. Last week, when the minister actually made the media briefing, Minister Dr. Pasha, we're sitting at 34.1% of the adult population. To date, in this announcement, we are sitting at we're 33 now. We are 34.6 today. And I can definitely tell you, Sally, next week when we make a media brief, we'll be sitting at 35%, which is almost half of the adult population that we want to actually give the jabs. We would still want to really continue getting our people coming in and taking up this offer as we are starting with the children again, because there's still this window, Sally, between now and the fourth wave. We don't know when it's coming in.
Right.
To come in, our staff members have. Yes.
Yeah.
So we would encourage people to come forward and then give a jab and get a jab right now.
Get it now, get it done before the fourth wave arrives. And thank you so much for your time this evening. Great to chat to you, Deputy Health Minister Dr. Sibongiseni Dhlomo.